Hello, my name is Rachel and this is my Unit 8 presentation on the roles and responsibility of a registered nurse. Today we will be discussing the recent changes and the impact that they had on the roles and responsibilities of the registered nurse, and discuss the role of the Nursing and Midwifery Council in relation to nursing practice, the implications of the Code of Nursing Practice and the role of the registered nurse, a description of why effective communication is essential in a multidisciplinary healthcare setting, and assess the value of a multidisciplinary approach in a healthcare environment. So let's first clarify what a registered nurse is, before getting into more details about the responsibilities and duties of a registered nurse. A registered nurse is a qualified healthcare provider who offers direct patient care in a variety of hospital and community settings. These could include hospitals, doctors' offices, nursing homes, prisons, long-term care facilities, families' homes and other facilities. Registered nurses are in many respects the backbone of the healthcare system. They conduct a variety of tasks and interact directly with patients, physicians and other healthcare workers. Nurses are known to possess traits like kindness, fairness, compassion, reliability, emotional stability, empathy and, again, compassion. Nurses are expected not only to maintain professional standards but also to follow clinical leadership. Clinical governance is a system by which healthcare providers can continuously monitor and improve the quality of their services and safeguard high standards of care. In the last 50 years, there have been significant changes in the nursing sector, including changes in uniforms, pay, job demand, duties of nurses, including differences in roles for men and women, technology, lawsuits and documentation, holistic care and patient load, which is the quantity of patients. Modernisation of the NHS has led to significant role and responsibility changes for nursing professionals. Formerly, nurses were considered doctors' assistants and were predominantly female, had little authority and had little formal education. The government said in April 2020 that it will clear £13 billion in NHS debt, allowing trusts to enhance their infrastructure, staff and technology resources. In 2020, the government also vowed to educate 50,000 more nurses and confirmed the creation of 40 new hospitals by 2030. The modernisation of nursing is said to have been started by Florence Nightingale. Her guiding principles were kindness, confidence, keen observation, effective communication and teaching, all of which are still valued in the field today. Florence Nightingale advocated for the improvement of nursing education by providing politicians with her own statistics. In 1860, she created the Nightingale School of Nursing. Nowadays, nursing education is far more demanding and challenging than it was decades ago. In 1990, Project 2000 was established. This was a higher education programme for nursing qualifications. Now, to practice as a fully qualified nurse, all nurses must undergo university-level training. Once qualified, they usually go into one of the 4 fields of nursing: adults, children's, learning disability or mental health. To keep up with the most current trends and information used in contemporary culture, all nurses today are obliged to attend and successfully complete continuing education programmes. According to Upton and Brooks 2000, the responsibilities and skill profiles of nurses and other health professionals have been directly impacted by the following sorts of development. Political, government policies and healthcare services have changed to be more patient-centred since the NHS was established in 1948 to empower individuals to take responsibility for their own health. Economic, the government's allocation of funds for healthcare is determined by the amount of tax revenue received from the general population. Social changes in healthcare are brought about by rising demands on resources, longer lifespans and rising expenses for caring for the most vulnerable and chronically ill. And technology and scientific. The amount of technology available to nurses in 2010 compared to previous years has increased significantly, and modern nurses are far more technically advanced than nurses from 50 years ago. Looking at the slide here, you can see the comparison of a vintage kidney machine and a modern kidney machine. Kolff used a rotating drum kidney he had developed to perform a week-long dialysis treatment on a 67-year-old patient who had been admitted to the hospital with acute kidney failure. The patient was subsequently discharged with normal kidney function. Modern technology makes the device more convenient and portable. It enables the patient to treat themselves at home and have various benefits such as fewer hospital stays, feeling healthy after treatment, improved sleep and prolonged good quality of life. And then there's organisational changes. In 2013, clinical commissions groups were established because of the Francis Report, which suggested that improved patient care will result from better leadership and transparent communication channels. Primary care trusts were replaced by CCGs, who are now in charge of commissioning primary care services as well as some specialty hospitals. This meant that as part of their job, nurses would have to risk assessment and follow other safety regulations. And professionalisation. Nurses now have greater influence over their practice thanks to their growing skill set. Today, nurses may be thought of as licensed professionals who practice independently with their area of expertise and are registered within the Nursing and Midwifery Council. They are responsible for providing safe, high-quality care, safeguarding patients and advocating on their behalf. They can work in multidisciplinary settings to combine their skills to obtain their greatest outcome for their patients. They frequently have a more thorough awareness of the entire problem than the doctors that they collaborate with. In addition to being skilled and honest, nurses must also be able to plan and manage patient care, think meticulously regarding their practice and solve problems. A registered nurse is an advocate who prioritises and make it possible to meet people's preferences and demands. And policy. The RCN was established in 2010 when it separated its charitable and trade union operations. The RCN sets out 4 key areas: competence, professional values, communication and interpersonal skills. Okay. The UKCC is the United Kingdom Central Council for Nursing, Midwifery and Health Visiting, and the GNC, which is General Nursing Council for England and Wales, were replaced in 2002 by the Nursing and Midwifery Order 2001. The Nursing and Midwifery Council regulate nurses and midwives in the United Kingdom and also nursing associates in England. The code sets out the standard of practice and behaviour they expect of all registered healthcare professionals. Student nurses must register with the NMC to begin employment after completing their degree. Individuals must meet the eligibility conditions and pass the competency test to accomplish this. A new test was reviewed in August 2021 to reflect new standards and what was expected of all nurses and midwives. Since 2016, the NMC requires that nurses revalidate their registration every 3 years in order to keep up with ethical nursing practice. A health and character declaration, professional indemnity and insurance arrangements that are appropriate, 450 practice hours, 35 hours of continuing professional development, 5 practice-related feedback items, 5 written reflective accounts, a reflective conversation with an NMC registrant, and confirmation that all requirements have been met are included. The process for revalidation promotes moral behaviour and boosts public confidence in nurses and midwives. The NMC runs fitness to practice panels when a registrant is the subject of a complaint or concern. To ensure that the nurse is still doing their duties safely and efficiently, individuals may face penalties from the NMC, including warnings, practice-related restrictions, suspensions or orders to be struck off the register. In November 2021, the National Retention Programme created the National Preceptorship for Nursing Project. The main purpose is to acclimatise and integrate freshly registered practitioners into their new teams and workplaces. It focuses on 5 core themes: organisational culture and preceptorship, quality and oversight of preceptorship, preceptee empowerment, preparing preceptors for their supporting role, and the preceptorship programme. The NMC significantly influences health and social care through professional regulation and support. They raise their voices to call for a safe and welcoming workplace for those who work in the health sector. They offer guidance on issues like the duty of candour in the workplace. The Code of Nursing Practice is structured around 4 themes: prioritising people, prioritise the needs of those who seek out the use nursing of midwifery services. The top priorities are their care and safety, as well as preserving their dignity, identifying, evaluating and meeting their needs. Nurses ensure that individuals receiving care are respected, that their rights are protected, and that discriminatory behaviour or practice towards those receiving care are contested. A person's right to accept or reject care and treatment must be supported and documented. Promoting health, preventing illness and fulfilling individuals' evolving requirements for care during all phases of life are all areas to which nurses must give particular attention. Nurses must also be able to spot when a patient is worried or in distress and must react empathetically and with compassion. This could be difficult due to time restrictions and limited resources, but nurses must make it a high priority. And practice effectively. Nurses must adhere to evidence-based practice. They do this by assessing the degree of need and, to the best of their abilities, give advice on or administer help, including preventative or rehabilitative treatment, without undue delay based on the best available evidence. In order to more effectively understand and deal with patients' personal and medical requirements, nurses must employ various kinds of verbal and non-verbal communication techniques, as well as take cultural diversity into account. Nurses are skilled communicators who keep accurate and thorough records and share their knowledge and expertise and experiences as required. They thoroughly evaluate every feedback and respond appropriately. All nurses should participate in ongoing professional development, which is required to maintain registration with the NMC. And then preserve safety. Nurses watch out for the safety of their patients and the general public. Nurses must be honest and upfront with all patients regarding all aspects of their care and treatment, including any errors or damages that may have occurred. When situations arise that endanger the safety of patients or the general public, they use their professional duty of candour and raise concerns right away. Nurses work within the parameters of their competence when required. They take the necessary steps to address any issues. And to promote professionalism and trust. The importance of the nursing profession is continuously promoted by nurses. They are expected to demonstrate a personal dedication to upholding the moral and professional standards stated in the code. Nurses should provide an example of integrity and leadership for others to follow. Because of this, patients and other medical professionals and the general public should start to have faith in the professions. Any complaints made against a nurse must be managed properly, and the individual filing them must get fair treatment. Any inquiry and audit needs the nurse's full assistance. Nurses are required to maintain a neutral environment and set up distinct professional boundaries in all contact with patients under their care, including those that have previously been under their care and their family members. Although the NMC sets the code, these requirements reflect what the general public and patients believe all medical professionals need to do. A multidisciplinary team is a group of healthcare professionals who work together to decide how to treat diverse patients and service users. This team may include representatives of different organisations and professions, such as GPs, social workers and nurses. Communication is essential for a multidisciplinary team to work together successfully to accomplish their shared objective of providing patient care. Multidisciplinary teams are excellent for patient outcomes, for instance, sharing and facilitating a mutual beneficial exchange of ideas, professional knowledge and skills. The combination of unique abilities, knowledge and expertise all helps to address the patient's overall needs. However, since stress, distractions and personality traits can affect communication, there is an increased chance that the information provided will be misinterpreted and lead to conflict. This is the reason it is so important for people working in a multidisciplinary team to communicate in a concise and clear manner, to be aware of verbal and non-verbal communication such as tone of voice, facial expression and body language, and for everyone on the team to engage in active listening. Effective and successful communication depends on trust. A nurse should be able to establish a relationship of trust with their patients. It is crucial since it enables information sharing and generates positive outcomes for the patient's healthcare needs. According to Bloomfield and Pegram in 2015, compassionate and empathic concern for others is an integral part of caring. Examples include taking the time to listen to a patient's concern or responding sensitively to their needs. Okay, so the 8 factors that serve as a summary of what contributes to effective multidisciplinary collaboration are: everyone works towards the same goal, everyone follows an agreed approach and works within their own scope of practice, everyone is committed to supporting teamwork in terms of time, input and resources, everyone cooperates, there is a mutual respect between health professionals and patients, the working relationship in the team are based on openness and trust, there's an agreed framework for reviewing and evaluating effectiveness, a coordinator is responsible for ensuring actions are conducted within a set time frame, and there is a shared awareness and understanding of partner organisations which can be achieved through networking. A successful multidisciplinary team will ensure that all members adhere to the 8 factors and are accountable for their action, share responsibility for attaining a common objective and have a clear understanding of their roles within the group. There are no independent working subgroups because each team member depends on one another and the whole group reports to a bigger organisation. And according to Section 3 of the NMC Code, nurses are required to recognise and address patients' physical, social and psychological needs. When it is beneficial for the patient, they refer patients to another doctor who specialises in that field. Section 13. Okay, so Health Education England created an MDT toolkit which is used alongside existing frameworks to aid in collating evidence built around 6 enablers, which are 1. Planning and design. 6 steps of or the HEE STAR can support this process. Skill mix and learning, ensure adequate training and mentoring so that employers can do their duties and respect one another. Culture, be open-minded and establish psychological safety so that ideas may be discussed freely. Shared goals and objectives, joint working demands clear, practical and achievable goals and objectives that are understood and agreed upon by all participants. And working across boundaries, consider strategies to co-locate teams wherever possible, especially when working across organisational boundaries. And 6, communication. Effective communication is essential for providing safe, high-quality care. All members are encouraged to use this toolkit as well as a set of agreements for shared care, which is an agreement between professionals that describes how responsibility for administering prescription drugs is between the professional and the primary prescriber. This agreement also facilitates a seamless transition for patients from secondary care to primary care for their medication needs and clearly defines the responsibilities of GPs and consultants. It is important that all members of the MDT have a clear understanding of each person's role and that they all adhere to agreed guidelines and follow policies, rules and procedures to organise tasks. There should be a coordinator who ensures that activities go as planned and that everything runs smoothly according to the treatment plan. Nurses are advocates for their patients and participate in all meetings and are required to express their opinions regarding the holistic needs of the patient to other healthcare professionals. Holistic nursing is a practice of nursing that consists of healing the individual as a whole person. This practice recognises that a person is not simply his or her illness. Holistic healing addresses the interconnectedness of the mind, body, spirit, and social, cultural, emotional relationship, context, and environment. Virginia Henderson, a nurse from the United States, implemented a fresh perspective on healthcare in 1966 and established systematic techniques to nursing care. She highlights the significance of patients' independence and believes that the patient is the sum of their parts, having biological, psychological, sociological, and spiritual requirements. The person must satisfy fundamental needs to preserve health, and people's minds and bodies are connected. Virginia recognised 14 activities of living and created a framework for nurses to utilise when patients were struggling to meet their needs. The 14 elements are: breathe normal, eat and drink adequately, eliminate body waste, move and maintain desirable postures, sleep and rest, select suitable clothes to dress and undress, maintain body temperature within normal range by adjusting clothing and modifying the environment, keep the body clean and well groomed and protect the integument, avoid dangers in the environment and avoid injuring others, communicate with others in expressing emotional needs, fears or opinions, worship according to one's faith, work in such a way that there is a sense of accomplishment, play or participate in various forms of recreation, and learn, discover or satisfy the curiosity that leads to normal development and health, and use the available health facilities. Okay, slide 12 shows how this framework can be used in conjunctions with other methods, such as the Maslow hierarchy of needs pyramid diagram. Henderson said the unique function of the nurse is to assist the individual, sick or well, in the performing of those activities, contributing to health or its recovery, or to a peaceful death. That he would perform unaided if he had the necessary strength, will or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Maslow, a psychologist, had the opinion that people were incapable of concentrating on the requirements at the top of the pyramid until they had mostly met the wants at the bottom of the pyramid. Maslow also believed that meeting the needs at all 5 levels leads to fulfillment in life. The primary goal of the MDT is to provide the patient with the appropriate person-centred, coordinated care and support. Health professionals collaborate to develop a treatment plan, and by jointly incorporating Maslow's and Henderson's theories, the individual is inspired to contribute to their development of their independence by making decisions about their own health. Henderson's 14 actions are applied to the pyramid to demonstrate how patients may start at the bottom by taking care of their most basic requirements and move to the top by persistently trying to improve their health and well-being. This is just one of many tools nurses use to help provide patients with safe evidence-based care. Other examples are the ABCD airway, which is the airway, breathing, circulating, disability and exposure. This is used to assess patients' sociology, BMI, body mass index, which is used to calculate the amount of body fat relative to a person's weight and height. The Wong-Baker's Faces pain rating scale, communication aid to help patients express their pain, and FAST, which is used to recognise the signs of a stroke. So gone are the days when only healthcare professionals could provide quality care that satisfied patients. These days, patients are rarely cared for by just one specialist. The global need for high-quality patient care now requires intensive attention and a patient-centred team approach. Sharing responsibility and accountability among team members can be a great advantage. However, in practice, shared responsibility without quality teamwork can create immediate risk for patients. There are several advantages and limitations/disadvantages to consider when evaluating the role of multidisciplinary teams using the MDT approach. The benefits include improved patient-centred care, mutual understanding of patient needs through shared knowledge and experience, patient engagement and accountability, building patients' trust, reducing patient readmissions, and improving continuity of care. The downside is that different opinions and personalities can lead to conflict, and healthcare professionals may seem inconsistent with patients. Patients may feel anxious about opening up to multiple healthcare professionals, and poor communication can affect the quality of care provided to patients. Time pressures can be a disadvantage, as meetings must be held regular and may last 2 to 3 hours. Health professionals need to attend these meetings on top of their normal duties. Challenges could arise when trying to arrange regular meetings to fit everyone's schedule. Although this process is a collaborative one, non-collaborative elements emerge. Research shows that the MDTs are suitable for a whole range of patients, including elderly people, children and individuals with mental health problems. It is especially suitable for patients with complex needs and long-term conditions. As medicine has advanced throughout the years, nursing practices has altered as well. To keep up with advances in medicine, nurses' tasks and responsibilities have had to evolve. We are aware that nurses must adhere to the set of rules established by the NMC, since this organisation is responsible for regulating nurses, providing them with rules and ensuring that these standards are consistently fulfilled. Therefore, nurses play an integral part in the healthcare system and do their best to remain resilient in the face of multiple challenging situations.